Good day, sir. I am Chris Medel Tayopon, your nursing aide for today. And today we're going to demonstrate removing a nasogastric tube. Equipments and materials needed: disposable gloves, um, disposable pad or towel, tissue, 50 ml syringe, which is optional, then plastic bag, um, trash bag. Then for assessment, we're going to assess for the presence of the vowel sounds of the client. Excuse me, sir. Sounds good. Next, assess the absence of nausea and vomiting when the tube is clamped. Sir, do you feel anything?
No.
Okay. Then next, for planning, we're going to check the client's status, which is fine for now. Then identify all materials needed and bring it to the bedside of the clients so that we can save time and effort during the procedure. Here's the materials we need. Then next, implementation. Introduce self and verify client's identity using agency protocol. Then explain to the client what we are going to do, why it is necessary, and how she or he can cooperate the procedure. Um, so good day, sir. I am Nurse Madel. Your nurse for today. May I know your name?
I am Nelson.
Okay, thank you. Sir, today we're going to remove your tube. In that way, you can eat by mouth if what you want, but uh, um, that was based upon the doctor's order, or he has permit to what you are going to intake food or fluids. Then I hope you can cooperate with me. Thank you. Then next, we're going to assist the client in sitting position if his health permits in that position. But if not, just really in his position right now. Then we're going to perform hand hygiene. Then we need to observe uh, any infection procedures that we can use. Then afterwards, we are going to provide privacy to the client by closing the curtain around the bed or close the door if applicable. Then place disposable pad or towel across the client's chest so that it will collect any secretions from the tube when we remove. And then we are going to provide also tissue to the client so that he will use this one to wipe his nose and mouth when the tube is removed. Sir, can you please hold this one? You can use it later. Thank you. And then next, we're going to detach the tube. So first, we're going to disconnect the nasogastric tube to the suction machine if it is present. Then unpin the tube from the gown of the client. And then afterwards, we're going to remove the the adhesive tape. Excuse me, sir. I'll just remove this one. And then afterwards, we're going to remove the nasogastric tube. But before that, we are going to put on gloves for our safety. Next, we can install 50 ml of air into the tube, but it was optional because that method can clear the tube of any contents such as feeding or gastric drainage. Then we can ask the client to take a deep breath, then hold in, so that if we are going to remove the tube, we can prevent aspiration of any secretions in the tube into his throat. Then we are going to slowly withdraw after that. Excuse me, sir. Can you please take a deep breath? Okay, thank you. Then we're going to slowly remove. We are going to pinch so that pinching it will the tube will prevent any content uh, to drain into the client. Then we are going to put it into the plastic bag. Putting the tube into the plastic bag immediately will prevent the transference of the um, contamination or microorganism to from the tube to any article or people that is present or uh, near in the uh, place. Then next we're going to observe um, the tube intactness. Then next we are going to ensure that the client's comfort. Sir, do you feel comfortable?
Yeah.
Okay, thank you. Then provide mouth care to the client if desired. Then we are going to assist the client to blow the nose so that if there is excessive secretion may have accumulate into the nasal passage. Sir, can you please blow your nose? Oh, thank you. That's good. Then next, we are going to assist the client. Then afterwards, we are going to dispose all materials that we use in the procedure. So we are going to dispose all the equipments into the proper receptacle designated by the hospital's protocol, such as the gloves, the pad, the tube, and the bag. Then because um, putting it in correct receptacle will prevent transmission of microorganism. Afterwards, we need to wash our hands. For evaluation, we need to follow up examinations such as uh, presence of vowel sounds. If there is, then absence of nausea and vomiting when the tube is removed, then intactness of tissue of the nares, and we are going to relate findings to the previous assessment data if available. So, sir, do you feel anything now? How about when I remove the tube? Do you feel fine?
Yeah, feel fine.
Okay, that's good to hear. Then, next for documentation, we have to record the removal procedure, the method, then the amount and the appearance of the drainage when we uh, remove the tube, then if there is anything that is connect, such as suction machine, then any relevant assessment findings to the client or any adverse reaction, we are going to uh, record it into the nurse's notes. Then so uh, on January 18, 2021 at 3 p.m., NGT removal was done. The appearance and amount is good without any suction is connected. No any connected machine. Then the client feel relief when the tube or nasogastric tube is finally removed from him. That's all. Thank you.